Hi Susan, are you ready to receive Mr. Aziz now?
Sure.
Mr. Aziz had an intercostal catheter inserted this morning after a spontaneous pneumothorax. The procedure went well and Mr. Aziz is resting comfortably now after taking some pain medication an hour ago. He's been prescribed regular pain medication on his medication record.
Okay. I'll check his pain level when I do his observations in an hour.
The tube was sutured to the skin with a mattress suture and has also been taped to the patient's abdomen. It's connected to an underwater sealed drainage bottle with the drain tube sitting below the water level in the bottle. There's 500 ml of sterile water in the bottle. The tube was sutured to the skin with a mattress suture and has also been taped to the patient's abdomen. It's connected to an underwater sealed drainage bottle with the drain.
Okay.
Please make sure that the chest drain is always kept below chest level and the drain tube is always under the water level.
All right.
The drain bottle's in a bottle stand so it stays upright. Could you make sure that Mr. Aziz keeps the bottle below the level of his waist when he walks around?
Okay. I'll make sure I tell him that. Is the chest drain on suction?
Yes, it has to remain on low suction. That's between 3 and 5 kilopascals until it's reviewed by the respiratory doctors.
Right.
I've put a transparent dressing around the catheter insertion site, so it's easy to check for infection or bleeding. I've also taped the tube connections so they are secure.
Great. Thanks. I'll keep an eye on it.
I've started an underwater sealed drainage observation chart. All clinical observations are within normal limits. They need to be done hourly for 4 hours, then 4 hourly for 24 hours.
Okay.
I did the first chest drain observations just before handover. The tube is patent and not kinked. There is no air leak around the drain site. The drain is bubbling slightly when the patient breathes out or coughs.
That's normal, right?
Yes. A small amount of bubbling indicates that air is being drawn out from the pleural space. But continuous bubbling must be reported immediately. This could mean a serious air leak.
Okay. I understand.
The tube is swinging. This means that the water level in the drainage tube moves up and down at the same time as the patient's respirations.
How long will Mr. Aziz have the chest drain?
He'll need to have the drain for 24 hours after the bubbling has stopped. That will mean that the air leak has healed. Before then, it's important that Mr. Aziz is encouraged to mobilize and do deep breathing exercises.
Okay. I'll tell him to do that. Thanks for the handover.